Hello friends, today we'll discuss something related to amenorrhea. So that 25% of thing which we were discussing of menstrual problems, which add AUB, which add dysmenorrhea, and now we are discussing something related to amenorrhea. So this is done, and amenorrhea is something which we will do it today. And one more thing which I need to add is menopausal problems. Okay, so also we will deal it in later subsequent videos. For today's class we'll learn something related to amenorrhea. So if you see as such, uh, first going to our normal approach. So anything, if you need to say a person is amenorrheic, you need to classify a person as amenorrheic. You need to know the proper definition. So what does the definition of amenorrhea say? So if you understand the etymological meaning of it, A is absence of menses. Okay, so that is absence of menses. So after this you need to know the classification. So it can be either primary or secondary. So in case of primary, never happened. Okay. In case of secondary, happened, but now it's not happening. So when will you categorize a person? According to Datta, they say 6 months or less than 9 cycles per year. But clinically, even if it's less than if it's less than 3 months, if it's more than 3 months, then you start treatment of secondary amenorrhea. So this video is something related to primary itself, okay, so that we can see what is the actual problem of the condition. Got it? So firstly we'll see what is the definition of primary amenorrhea. So according to Datta itself, the definition of, why do you think definition is important, students? See, if you know the definition, then you know when to say a patient as amenorrheic. If you cannot classify a person as amenorrheic, then how will you manage, how will you treat, how will you investigate? The basic thing is to first classify a person, right? So that's how a definition is important. I never told you to remember the whole definition. No, even I don't remember. That's not required. For what is important is the minimum knowledge, so that you know when do you classify a person as amenorrheic. So they say amenorrhea is defined as absence of menses. Okay, absence of menses by 13 years of age with absence of breast bud. Okay, so there should be no menses also, and there should be no breast bud also by 13 years of age. Or if menses breast bud is present but no menses by 15 years of age, or if breast bud is present, okay, that means she has attained TLRK and no menses after or more than 3 years of age. Okay, so now you know when to classify a person as amenorrheic, correct? No, so by 13 years of age, no menses and no absence of breast bud, primary amenorrheic. Presence of breast bud but no menses by 15 years of age, primary amenorrheic. If she has she has attained TLRK but no menses, if no menses for past 3 years, then it is primary amenorrheic. So now you know how to classify a person. That is primary amenorrheic. Correct? No. Now you know so much. Now coming to our usual approach of anat, physio, patho. Correct? So what is the major thing which we learned? Anat, physio and patho. Correct? So again the same thing. See, I'm not, if you have watched first videos and if you come here, you will understand what I'm speaking. The importance of approach to gynecology is so much that if you don't understand that, here there is no point in understanding what I'm saying. Okay, so again it's hypothalamus and pituitary, then thyroid and endocrine. Next, the major chunk is formed by all these uterus, cervix, and vagina. Okay, so now I will discuss what are the. I am talking only about primary amenorrhea here. Okay, now we'll discuss what are the conditions which can cause primary amenorrhea. Okay, see, for for an for a menses to occur, there should be proper uterus, there should be proper intact cervix, and a proper vagina. This is major, right? Okay, otherwise you will never menstruate. Am I right? So this is something which is very very important. Then what is very important? Gonads. If there is no gonads, then who will produce estrogen? Huh? Who will produce estrogen, and who will when will it how will the uterus shed? Correct, no? So that is also important. So major thing is first should think about is, see, that is when statistics comes to action. So why do you think I discuss statistics in every part of the video? See, if you know the statistics, you know your thinking. So okay, this is the most common cause. Then why do you think Indian exam asks which is the most common thing? Do you think they are mad? No, they want you to know whether you know the statistics of Indian population, so that you are competent enough to deal with a good number of cases. I will deal about statistics later, but now understand what I am speaking. So primary amenorrhea can be seen in cases of gonadal dysgenesis. Okay, gonadal dysgenesis. Then any uterine abnormalities, that is, or your Mullerian malformation. This is second thing. Then all this cervical causes, if there is imperforate hymen, or absence of vagina, in cases of even cryptomenoria, this crosses cryptomenoria, right? So these also causes primary amenorrhea. Okay, now this is something which was local. So you need gonad to produce estrogen, you need uterus to properly properly grow, and hymen so that the flow occurs. And also coming to the physiology part of it, so these things I discussed in anat. So in gonad also, what do you think which is the most common thing? Absence of gonad. See, 40 to 50% of the case I will discuss about statistics is about Turner's man. Okay, that is the main common cause. I will come about it. Okay, now coming to our proper physiology. So what is this? Hypothalamus, pituitary, then thyroid, insulin, all those things. So if there is no GnRH production, which you know is Kalman syndrome, it also leads to primary amenorrhea. Okay, that is one thing I wanted to discuss. So here basically either you might have pituitary or hypothalamic dysfunction, or endocrinal abnormalities like hypothyroid. Got it? Now coming to part 2. So basically remember chronic infection, again talking with respect to Robbins only, chronic infection like any TB or any mum. TB is enough, okay, mums in case of females, I'm not talking about that, can predispose to primary amenorrhea. Next chapter is about genetic conditions. So genetic conditions like Turner syndrome, okay, then Kalman syndrome, Swyer syndrome. This we will discuss, okay, don't worry. This also causes primary amenorrhea. Okay, so now you know what are the things, what are the problems, correct, no? Which you can see in this case. So as such, now see, this is the gist. Now lost, stay with me. Lost, I am talking about, let me use another color so that it's visible. Statistics, because that is something which will make you see what you are seeing. So statistics, if we see, okay, in 100 patient of primary amenorrhea, okay, I am classifying what are the cases which you get. Okay, almost 40 to 50% of the case is something to do with gonadal dysgenesis, and most of the patients are of, yes, Turner's. So if you know this gonadal dysgenesis part well, that means you know 40 to 50% of the case you are dealing with. Got it. Next, we have something called as uterine abnormalities, that is Mullerian agenesis. Okay. Then you are dealing with almost 25% of the cases. You have all this septate, correct? No? Yeah. Then what? Didelphus. That in subsequent videos I will teach how to go about it. Next, you have 15% of the cases are something to do with hypothalamus, like Kalman, okay, all those things. Then again, remaining 2 to 3% something to do with pituitary. Then other causes 1% might be other like PCOS, all those things. Okay. So this is the overall gist. See this photo I would like to show you here, friends, because see, this is from Shaw's. I hope you know Shaw's is one of the standard textbooks. See, they're saying, see, primary amenorrhea, see, it can be physiological. It can be physiological sometimes. Okay. So basically, you should know how do you classify it. See, these conditions overlap each other. That means I mean to say, these can be seen in both primary amenorrhea and secondary amenorrhea, but these are something which are sold to primary amenorrheic. So if a patient comes to you, you should of a primary amenorrheic, you should majorly think about this, but also has to keep this in mind. In next video, we'll see the workup of all these things. But see, have I not discussed about disorders of sexual development? See, gonadal dysgenesis I have talked, Mullerian agenesis I have talked, GnRH deficiency I have talked, imperforate type 1 I have talked, transverse vaginal septum I have talked, physiological delay I told. Then also see, there's something called as AIS, that is androgen insensitivity syndrome. Let me include this somewhere. Okay. So see, there is normal androgens. Okay, but what happens here in this case is there is no sensitivity. The receptors doesn't work. So as a default, see, default sex of human is female. Okay. So as a default, they will have female sex, but they will have palpable testes in the inguinal region. So that also a case of primary amenorrheic, because they are not female to menstruate, right? So they will come up with a case of primary amenorrheic. And also see, one more important thing which I need to discuss here about anat is, take about adrenal glands. Okay, adrenal glands, so even they produce androgens, so they also become a very integral part. Okay, see here in this PDF, see all this Cushing's, chronic illness are related to patho I talked, functional this thyroid disorders I touched. Why do you think I'm talking about this thing is, see, in subsequent videos all the CH and all will come. Okay, in those things I will discuss why I talked about these things. Okay, now you know the stats also. Okay, coming to the revision, see, I talked about the 25% things which we are dealing with right now. So in that we have finished AUB, dysmenorrhea, amenorrhea is something which we are doing. In that we discussed about the classification. There is primary and secondary. Primary is never happened. So in that we discussed why is definition important, because to classify a patient or say a patient is primary amenorrheic, correct? No. So that for that you need to know the definition. According to definition, we told when do you call a patient as primary amenorrheic? 13 years, absence of breast pad or present but no menses till 15 years, or presence of TLRK and no menses till 3 plus or 3 years. Then we discussed our basic approach, that is our anat physiopatho approach, which we use for everything. The first strata approach, which you know, hypothalamus, pituitary, then endocrine, then the normal vagina and the uterus. In that you can have gonadal dysgenesis in 40 to 50% of the cases it's Turner's. Then uterus is important because without uterus there is no shedding. So uterine abnormalities, then imperforate hymen or absence of vagina, Then with respect to GNRH, you might have absence of GNRH like in Kallmann syndromes and also in specific endocrine condition. Coming to pathochronic infection can predispose to primary amenorrhea. Then these are the genetic conditions which we think of. Then statistics wise, I told which is most important and which you should know. And we discussed about SHAW's what is it chart. Okay, so in the gist you should know this. So subsequent classes will deal with the workup of these basic things. Got it? So make sure you have this picture in your mind. Okay. Rest of the thing we'll do in the next class. Fine. Okay. Thank you. Have a good day.